First, the latest tonight on the nationwide vaping crisis. Good evening, I'm Mike Montecalvo. Today, deaths were reported in Florida and Georgia, bringing the nationwide total now to 11. In the meantime, the CEO of the largest e-cigarette company, Juul, has stepped down. Here in Rhode Island, Governor Gina Raimondo is following Massachusetts' lead to ban the sale of flavored vaping products. But not everyone is on board with this decision. Eyewitness News reporter Molly O'Brien joins us with what health officials and vaping store workers are saying about the crackdown. Molly?
Thank you, Mike. Well, we've spoken to many vape users, some telling us that vaping saved their lives. And with new efforts taken by state regulators, these consumers tell us they're worried about their vaping options potentially being taken away.
I tried Chantix. I had a lot of bad side effects. I tried gum. I tried patches. Nothing worked. But vaping did.
John Malika says he quit smoking after watching his father die from the negative impacts of tobacco.
Banning vaping would be not only a detriment to Rhode Island, but it's a detriment to the entire country and what's going on right now.
Malika and many others are speaking up about their choice to consume vaping products as Rhode Island's Governor Gina Raimondo signed an executive order Wednesday that works toward banning flavored vaping products from stores for 120 days.
And they look fun and flavorful and healthy. And actually, it's the exact opposite. It's dangerous for our kids.
Raimondo and the Rhode Island Department of Health take action in response to an outbreak of lung injury nationwide. The CDC reports 530 cases of confirmed lung injury associated with the use of vaping products and 7 deaths. No cases are present in Rhode Island. Raimondo says this is just the first step to addressing the crisis, but assures adult vape users they can still use non-flavored products.
Electronic cigarettes and tobacco products will still be available, and adults who are using them to quit smoking, that will still be readily available.
According to the National Institute on Drug Abuse, e-cigarettes are not an FDA-approved quit aid. Jennifer Wall with the Rhode Island American Lung Association suggests adults who are looking to quit smoking should use an FDA-approved method.
Lozenges, Nicorette, gum, anything that has been approved and gone through the regulatory process.
And as of last week, the minimum legal age of sale in Rhode Island and New Hampshire was still set at 18. Surrounding New England states have bumped their age up to 21. Live in the newsroom, I'm Molly O'Brien, Eyewitness News.